So I will be palpating around there, looking for any signs of infection or inflammation. And then, of course, having a look at the different chains of nodes. And just take normal breaths. And out. Very good.
99, 99, 99.
So just having a look to see if I note anything visibly.
A little bit further towards the jaw.
So if I come over this way, more tenderness here.
Yeah.
And moderate percussion at the umbilicus. No issues with mobility there. Hello. Hi, Sandra.
Hi.
How's it going today?
Okay, how are you?
I'm doing well. It's very nice to meet you. My name is Dr. Perez. I have you in as a first-time patient today.
Yes.
Welcome to the office. How are you feeling?
I'm okay, thank you.
Okay. Well, it's nice to see you. I was just peeking at your chart, having a look and seeing kind of why you are here today. Obviously, you were referred by your primary care physician. So, as I stated, my name is Dr. Perez and I am a gynecologist. I also specialize in endocrinology, which is hormone therapy, hormone balance, that kind of thing. So, from what I'm seeing, you have a pretty extensive both family medical history and personal medical history of hormonal imbalance.
Yes.
Okay. All right, well that gives me just a little bit of an idea of what we will be looking at today. So I'm just going to pull up your notes for this visit. Give me just 1 second. All right, here you are. Okay, so of course with all examinations, I'll just need you to confirm your name for me. So first name and date of birth, please.
Yes, Sandra.
Perfect. And your date of birth?
October.
Very good. So that does match up with what I have. And first question I tend to ask every patient is just how you are feeling today, both as far as pain, mental health. Are you feeling generally well, generally unwell? Are you concerned about anything specifically?
Today I feel okay.
Feel okay. All right, that's very good. Not in any pain, no headache.
No.
No, good. Okay. Well, that's very good news. Okay, so we can go ahead and get started. The initial portion of your examination is going to be just intake. I'm going to ask you a couple brief questions. I want to go ahead and get your blood pressure, of course, to see how you're doing now. My medical assistant did obtain the rest of your vitals, but I personally like to take the blood pressure myself just so I can get a manual reading and ensure that nothing is going on with your cardiac health. Do you have a history of high or low blood pressure,
It's high
hypertensive?
blood pressure.
Is that genetic or just something that you've suffered with personally?
It's genetic.
Genetic, okay. All right, so I will have a look at that today. Are you okay with me obtaining that in your left arm?
Yes.
Okay, so that will be the first thing we do. Let me just go ahead and obtain a few questions from you. Now, I have that you had your first menstrual cycle around 15 years old. Is that accurate?
Yes.
Okay. And it looks like you started having issues very early on. So abnormal periods, cramping, that kind of thing. Okay. All right. So the note that I see from your primary care physician is that you are here for a lymphatic assessment. So it looks like you've been experiencing some scalp infections as well as some swelling of the lymph nodes in the clavicular area. So basically around your collarbone, you notice just a little bit of swelling, and it looks like there's a note from him that your last exam, there was a few nodes that were palpable. Okay, so we will go ahead and have a closer look at that today. I have a few diagrams that I'll show you just so you know what to expect, and I'll be giving you a demonstration. It is minimally invasive, and then it is topical. I'll have you change into a gown. I'll describe the areas that I will be testing. That way nothing is surprising to you and you know what to expect from your examination today. Now, of course, if you have any questions or if at any point you're uncomfortable, you are more than welcome to let me know and we can reassess. Okay? So let's go ahead and start with your blood pressure. All right. It's going to be just a little bit taut here at the arm. I'll have you just relax that arm on your leg for me, and then if you can just keep your legs flat as they are with your feet uncrossed. Very good. All right. So I'm just going to place this here at the inner elbow. You're going to feel my blood pressure cuff pump up. It does get a little tight. Just bear with me. And just take normal breaths. And I'm going to start to slowly deflate the cuff. Very good. Okay. So your blood pressure is not high today. We're 125/78, which is well within normal limits. So that's very good.
Okay.
Do you know the last time you had an abnormal reading?
Probably about a week ago.
Okay.
Yeah.
All right. All right. Okay, so I'm just going to notate that here. All right, very good. Okay, Sandra, so a couple different things we can go over. I will start with just a bit of demonstrative information. That way you have kind of an idea what to expect from the remainder of your examination today. So give me just 1 second. All right, I believe I have... Okay, so just a couple things for you to look at here. So this is what we will be testing today for the most part. So from the notes, I did see that you have a few of these symptoms. So common symptoms of mainly cervical lymph node swelling or infection. It does look like you've had some issues with your scalp. So you said you've noticed some flaking as well as some redness at the scalp, which is abnormal for you. So I will be doing just a brief scalp assessment. I didn't see any notes about strep throat or tonsillitis. Have you noticed any swelling of the throat?
No, they took out my tonsils.
Did they?
That was
Okay, so
correct.
that would explain why you don't have that, of course. Now, you can still get strep throat without your tonsils. It is less likely as there's less obvious carriers for bacteria there, but I will be doing a palpation of your thyroid. Any ear infections recently?
No.
No. Okay. No pain or drainage of the ears or anything?
No.
Any illnesses, common colds, flu?
I had a cold recently.
Did you?
Yeah.
Okay. How many times a year would you say you get a cold?
Probably about 2 or 3 times.
Okay,
a
so
year.
about average, nothing that you would think is like anything suggesting that your immunity is compromised.
Right.
Okay. No signs of bronchitis, any coughing, dry cough, productive cough, any mucus?
Nothing outside of when I have a
Just
cold.
when you're sick. Okay. And then no issues with your mouth, dental health, that kind of thing, any pain of the jaw?
No, not of the
Not
jaw.
usually. Okay. All right. Okay, and then just to give you a bit of a closer look, so we will be looking at several glands. Now I will be palpating around the scalp, of course, and behind the ears. So I'm going to follow down here. Now this is what I was saying when I'll be having a look at your thyroid. So you have a butterfly-shaped gland in your throat. It's called your thyroid. So I will be palpating around there, looking for any signs of infection or inflammation. And then, of course, having a look at the different chains of nodes. I'm not going to describe them all to you as it's not very interesting, but just so you know, they're both on the left and right side, and they are symmetrical, so down the sides of the neck as well as along the clavicle. Okay? And then as far as lower body, just to give you a bit of a look here. So obviously this is anatomical. This is the pelvis. So we're starting at the abdomen, at the navel, and then going down towards the pelvis at the vaginal canal. Now, I'm not going to be performing a pelvic exam on you today, but I will be palpating around the pelvic area for your lymph nodes. Okay? So you have several nodes. The aortic nodes are up around the navel, so I will be briefly palpating the abdomen, and then of course you have your fallopian tube nodes that are here around your pelvis. So I would say right around your pelvic bone. If you go in just slightly, that's where the nodes are located. So maybe in the shower, if you ever feel anything swollen, not at the vagina, but externally, then we could be looking at swollen nodes. Okay? And of course, they go all the way down the sides near the femoral artery. So just to give you a bit of an idea of what we will be examining today, I find that it's helpful to give you a visual.
Okay.
And lastly, just wanted to give you an example here. So we're going to pretend that this is your body, whether it be your breast, your axillary area, or your inner thigh. I am going to be palpating in different motions. So you might feel a linear pattern, whether it be vertically or horizontally, as well as a circular pattern both with my hand and with my fingers.
Okay.
Is that something you're comfortable with for
Yes.
today? Okay. Like I said, if at any point it becomes uncomfortable, you are more than welcome to let me know.
Okay.
All right, Sandra, so aside from the educational materials, I have a few things that I need from you. I do need a urine sample. Are you able to urinate at this time? Do you need water?
I think I'm good, yeah.
Okay, so just a standard specimen cup, if you could fill it to about the 50 ml line for me. And then 3 cleansing wipes here, if you can use these to cleanse yourself externally so we don't compromise the specimen with any bacteria.
Okay.
I also have a gown here for you. I would like you to change into a hospital gown. I have just a belongings bag for your clothes. So take everything off for me, including your underwear. And then if you can just open the disposable privacy drape here, you can drape this over your waist.
Okay.
And of course, standard hospital gown, we are going to have it open in the back for today's examination, okay?
Okay.
All right. So I'm going to leave this with you. I'll give you about 5 minutes. Of course, I'll knock before I come in. You let me know if you're ready.
Okay.
Okay? Hello. Is it all right if I come in, Sandra?
Yeah.
Okay, perfect. Thank you for changing into your gown. I appreciate that. Are you comfortable?
Yes.
Okay. So we can go ahead and get started with the secondary portion of your examination, which is going to be a brief scalp check to look for any of those lesions that you were describing. I'm also going to come around the back and do the initial examination of your lymph nodes. I will do a secondary examination once I have you laid down. I'm also going to just check your heart and lungs, bit of cardiac and pulmonary health, just because I have you here today. Secondary to that, I am going to go ahead and obtain a viral sample from you. So just a brief oral swab to test for any viral infections to make sure that we are ruling out anything else that could be causing the inflammation. And it does look like my MA was unable to obtain your blood. Do they typically have difficulty getting blood from you?
It's a give or take.
Okay, so I'm gonna have a look. It's not my forte. I will have a look and see if I'm able to visualize the vein. If not, I can call the IV team and they can come in and do that after your appointment, but I'll try. Okay? All right. So why don't we start with the oral swab just to get it out of the way. Now you said the last time you were sick was a couple of weeks ago. Are you still experiencing any symptoms? Any
It just comes and goes.
comes and goes? Okay. Do you typically suffer from seasonal allergies or anything?
Not really.
Not really. Okay. All right. Okay, so I am just going to do a buccal swab bilaterally, so both sides on the inner cheek. If you could just open for me. Very good. And I will send this off to the lab. The results usually come back within 30 minutes or so, so we should know by the end of your visit if you have anything viral that we should be concerned about.
Okay.
Okay. I'm just going to drop this in the lab window. I will be right back.
Okay.
All right, Sandra, so the next thing we are going to do is see if I am able to visualize your veins. Now, my MA wasn't able to see anything, but I'm gonna go ahead and look. So I'm gonna try at the inner elbow. Any familiar history of anemia or vascular disease?
No.
So I do see some scar tissue here where it looks like you've had some long-term IVs in the past.
Yes.
So that could be what's causing the difficulty. It could be that the scar tissue is occluding visualization of the veins, which is fairly common. Just gonna have you make a fist for me. So I do feel one here, but you've got the rolling veins, so they like to move around as soon as we
They do.
find them. I'm going to put a tourniquet on you and see if that helps at all. So this is going to be just a little tight. Does that feel okay?
Yes.
Okay. I do see one here, but I don't think... Go ahead and relax your hand for me. I don't think it's worth the risk. I don't want to have to poke you more than once. So if you're comfortable with it, I can call the IV team, the vascular team, and they can come by. They have what's called a vein finder. It's just a big flashlight device basically that will allow them to see in your arm. Is that okay?
Yeah, that's fine.
Okay. All right, so we'll hold off on the blood specimen and I will have them come in at the end of your examination. Now the blood results do take a little bit longer, so looking at closer to about 48 hours to get those results back.
Okay.
All right. So I'm going to start at the front. If you could just take normal breaths for me. So far, not hearing any signs of cardiac abnormality. Very good auscultation here. So heart rhythm is well within normal limits. I'm hearing normal sinus, no signs of tachycardia or bradycardia, which just means your heart is not beating too fast or too slow. Not hearing any signs of occlusion. I'm going to have you take a deep breath in for me. Good, and out. Good, one more time. And out. Very good. Okay, I'm going to come around the back and do a pulmonary assessment. So just going to listen to your back, listening for lung sounds. You have been sick recently, so listening for any specific sounds of inflammation or any rigidity of the breathing, any signs of labored breathing. I'm going to have you take a deep breath in for me, Sandra. Good, and relax. And one more time. And relax. Okay. So finally, for your lung assessment, I'm going to tap you with my reflex hammer. Every time you feel me tap, I'd like you to say 99. All right. So heart and lungs both sound very healthy. Now, while I am behind you, I am going to go ahead and perform my scalp assessment. So just going to feel me touch around your neck, your hair, and I just want to have a look at the areas that you said you were slightly concerned about. Now, from what I saw in the notes, it looks like you said you feel some lesions kind of around the ear area. Okay. And I didn't see that you have a prolonged history of that, so it looks like that's something that's just started fairly recently. I do feel a little bit of swelling here. Is it tender or painful here?
Just a little bit when you're touching, yes.
Okay, all right. Just gonna feel around the top of the scalp as well. Feeling for any lumps or bumps of the cranium. Just using my metal tools here to have a look at the scalp. Some of these areas that are a little bit concerning. So I do see some redness here. Just a little bit of discoloration. So it looks like you have some scabbing. Has the area been itchy?
It has actually.
It has. Okay. One small lesion here behind the ear. Doesn't appear to be anything notable within the scalp itself, so it looks like it is isolated to kind of here behind the ear as well as down the nape of the neck. Look with my comb and my pen light. Okay, so I see one isolated area here directly behind the ear. Okay, so Sandra, I'm going to have you turn your head to the left for me. Okay, some slight swelling noted here. Okay, go ahead and turn to the right, please. Not as prominent here on the left side. Do you notice more of the symptoms, either physical or like the itchiness or the lesions? Do you notice them more on one side than the other?
No.
No. Okay. All right. So I'm I'm going to go ahead and place your hair back in the ponytail so I can have a feel of your lymph nodes. Do you have a hair tie? Very good. Does that feel okay?
Yes.
Okay. All right. So I am just going to firstly have a look at the area from behind. So looking for any signs of swelling that are notable externally. I do see just a little bit of inflammation here. Okay. So starting with physical manipulation here, I'm going to feel around with my fingers. Feeling a palpable node here on the right side. And this is the area that you said was just a little bit tender. Is it tender on the left as well?
Not as much as the right.
Not as much. Okay. Just following that down. Feeling for the clavicular nodes here. So your first chain of nodes down the neck and chest are right here at the side of the shoulder. And directly along the clavicle, posterior and anterior. Okay, so now I'm going to feel directly underneath the chin. Sometimes these are easier to feel when you're lying down, but so far nothing notable. So feeling directly along the thyroid. Feeling for any signs of swelling or inflammation here. So just having a look to see if I note anything visibly. So I'm going to have you swallow for me, Sandra. Good. Okay. I'm going to have you shrug your shoulders. Good. Okay. All right. So let me just come back around here. So my initial assessment of your nodes is that I do feel an area of swelling, so some slight edema here just below the ear. I did see those lesions that you were talking about. The blood specimen that we obtained could give us a better idea of what could be causing the swelling. If it's not a viral infection or you don't have anything going on with your immune system, then we could be looking at something wrong with your glands itself. So I am going to have you lay down for me. I'm going to do a secondary palpation of your nodes, and then we'll kind of move down and get started with the rest of the body as well. Okay? All right. Okay, Sandra. I'm going to go ahead and get started now. So I'm going to be performing a secondary evaluation of your clavicular nodes, and then I also want to have a feel around your abdomen, so the nodes that lie around the umbilicus, and then of course we will move down to do the pelvic nodes and briefly around the popliteal, which is just your inner ankle. Okay? All right. So if at any point anything is tender or uncomfortable, please let me know, because even if I can't feel something or the nodes are not palpable, if you're feeling tenderness, it could be that they're just a little bit deeper, and then we may need to do an ultrasound to check for internal inflammation. Okay? All right. So just relax for me. I'm going to start here at the neck. So secondary palpation palpation under the chin. Just feeling again around the clavicle, anterior and posterior, so just top and bottom, being sure to palpate directly along your clavicular nodes. So not feeling any signs of swelling here. Okay. Shining a bit of a bright light here, Sandra. Just keep your eyes closed for me. I'm just having a look at the artery itself, looking for any signs of distension. Okay. All right. So you're going to feel a little bit of pressure here. I have a pressurized tool. Does this feel tender at all?
Just a little bit.
A little bit. Does it feel any worse here?
No.
Okay. Any tenderness as I come down the neck?
A little bit further towards the jaw.
So if I come over this way, more tenderness here.
Yeah.
There's appear to be one node that's palpable here. So is this area about the most tender?
Yes.
Okay. All right, so I'm just going to take a mental note of that. We are about 2 by 2.5. Right side of the jaw. We have one node that is palpable here. All right. And along the clavicle collarbone here, any pain or tenderness?
No.
Good. All right. Okay. Again, just testing at that artery. I'm not noting any abnormal distension there, so that's a good sign. Okay, so beginning with my follow-up palpation here, I'm going to feel around underneath your breast, feeling for the nodes that lie here just above the rib cage. So just circular palpation, feeling for any signs of swelling here. Are you performing self-breast exams in the shower?
Yes.
Okay, very good. So definitely recommend keeping up with that as well as getting an annual mammogram. So far, nothing is palpable. Okay, so I'm going to have you extend your arm just slightly. I'm going to feel up in the axillary area, so feeling your underarm. We have several nodes here, so just superficial palpation to start. Do you ever feel any tenderness here?
No.
No. Okay. So oftentimes my patients think that they only need to perform self-breast exams of the breast tissue itself. Now, breast tissue does extend up into the axilla and down the extent of the arm. Okay, so when you're performing your examinations at home, please make sure that you are checking this area as well. Okay, so nothing notable there. All right. All right, Sandra, so I am just going to feel for bilateral nodes here. So just checking on the opposite side as well, feeling again along underneath the breastbone for any signs of swelling or inflammation here. So far, no tenderness of the area, correct?
No.
Okay. So I'll have you just extend your arm slightly. Again, going to feel the axillary nodes. So feeling underneath your arm along the lateral side of the breast tissue. And nothing here is palpable as well. Okay. So I'm going to continue along with my abdominal palpation, and then we will move on to pelvic as well as popliteal. So allow me to just adjust for 1 second. So go ahead and relax your arm for me. I'm going to begin my palpation of the abdomen. Now, let's start here up towards the top. Feeling right at the sternum, top 2 quadrants of the abdominal cavity. Deeper palpation as I come towards the umbilicus, palpating directly around your belly button now. Not feeling any signs of distension here, so checking for abnormal bloating, any signs of lumping or any bumps below or above the surface of the skin. Also feeling for your organs now. So I'm going to palpate for your liver. Bit of a firmer palpation here as I palpate around your organs. Performing a secondary palpation of the abdominal cavity. I want to make sure I'm feeling for any inflammation of the abdominal organs, specifically of the liver and the pancreas. So just using a flat-handed motion here. Okay. I'm going to feel around the pelvic bone, Sandra. You have several nodes here that lie along the region, and I'm just going to follow them down the lower extremity. Good. We're not feeling anything, which is a good sign. Just directly above the pelvic bone. signs of swelling or water retention at the lower extremity, which could indicate an issue with your lymphatic system. So, do you ever notice any water retention or swelling of your arms or legs?
No.
Oh, good. So if you start to notice that you're retaining quite a bit of water, specifically of the lower extremities, so lower calf area or your feet around your ankles as well as your toes, could indicate that your lymphatic system is not draining effectively. So that is something that would be notable. So be sure to either give a call to my office or to your primary care physician so that you can be tested for several different things, but making sure that there isn't anything going on here. So deep percussion directly on the pelvic bone. And moderate percussion at the umbilicus, looking for any signs of concave distension, which is not notable. No straining or bulging at the umbilicus, correct? No signs of any umbilical hernia or hernia at the belly button?
No.
Very good, okay. Any pain with lifting or bending over?
No.
Good. Okay. All right. So I'm just going to come down towards your feet. Okay, so lastly, going to briefly palpate around the calf and lower extremity, looking for any signs of swelling again. Same thing on this side, just feeling around. Your legs are just a touch cold. Do you tend to find that your legs and feet are a little bit colder most of the time?
Yes.
Okay. So it could be just a circulatory issue. Okay. Maybe just scrunch your toes for me, Sandra. Good, and this side. I know you're wearing footwear, but if you're able to stretch them out as far as you can. Good. Okay, so no issues with mobility there. So just doing a final palpation of the area. The nodes themselves do not appear palpable. I'm not feeling anything notable, no signs of distension. The anterior side of the ankle. And no notable swelling of the lower extremity. Just some slight symptoms of abnormal circulation. So that is something that I will note in your chart and we can keep an eye on it. Now at this point I would say I am comfortable concluding your lymphatic assessment. So I am going to have you remain in your room if you are comfortable. You can go ahead and get dressed. However, I will have the IV team come in shortly to obtain those lab samples that we were not able to get earlier. Okay?
Okay.
Did you have any questions for me at this point?
No.
No. Okay. So I'm going to load all of my notes today into your chart, all of which will be available in your patient portal. And secondary to that, I would say that the swelling around the right side of your ear as well as the scalp lesions do lead me to believe that there could be an issue with your hormones. I'm not thinking that this is something related to the cold that you had recently. So once I get your lab results back in about 48 hours, I will be contacting you so that we can discuss my findings a little bit more in depth, okay?
Okay.
All right. All right, Sandra. Well, thank you very much, and I hope you get home safely.